For the last few months, we all have the same topic of conversation: COVID-19. This is where the talk begins and ends. Nowadays, newspapers are full of news of the coronavirus. One word is heard on radio, TV. Such horrific pictures of the COVID-19 epidemic are coming out on social media, which are frightening to see and read. Many experts have already warned that the kind of information and messages being fired on COVID-19 will have a direct and immediate effect on our brain health. An environment of fear all the time also affects our psychology and sexual behavior. Our thinking about the disease becomes so deep that it makes us conservative with mood swings. We fall behind from the social point of view. In this regard, the kind of predictions made in the research report of scientists, if they prove to be true, then in the coming time, there will be a big psychological and social change in the world. Epidemics have been spreading before. In that period, no one survived was less than miracle. Even then, epidemics did not make everyone a victim. Those who had good immunity, they were saved from it. But the pandemics had a bad effect on those who survived. This means that those people did not start a normal life easily, such as meeting people, hunting, and engaging in sexual behavior. Fear used to sit deep inside them. Working with the disease to increase immunity is a really difficult task. To fight any disease, it is very important to have strong resistance of all kinds. Psychologists use words such as the behavioral immune system. That is, if fighting an epidemic, the first thing to do is to break its contact with its behavior. That is, it is necessary to make a distance from each other. Man is a social animal and has lived in groups. Social distancing has influenced our relationships and conversation of every day to a great extent. But it is necessary to stop the disease. Of course, when science had not progressed, our ancestors may not have been aware of ways to prevent and spread the disease. But today we know both the reason and the way to avoid it. Therefore, given the exaggeration of opportunity, if someone is avoiding doing social distancing because it will affect the relationship, then it is wrong. Many experiments have made it clear that when we feel the danger of some disease, then we accept the traditions by bowing our heads and we become more worthy of respect. One experiment asked participants more concerned with the disease what kind of people they liked. Almost everyone responded in favor of those who believed in traditional customs. That is, they liked people who followed the tradition more than creative or artistic people. This suggests that independent thinking, inventing, and innovating ideas are weakened during the transition. In them, there is a growing idea that breaking social norms can be harmful and its consequences can be fatal. Hollywood's 2011 film Contagion is in the news these days. The kind of situations and scenes depicted in the film is quite similar to the situation of today. However, that film has nothing to do with the current situation. That is just a great example of creativity. But this creativity is creating fear among people. Staying away from such creativity is forcing people to strengthen traditional thinking and inertia. Whenever an infection spreads, most people follow social rules more strictly. By following the rules, when we become the watchmen of morality, we do not even know ourselves. For example, bathing daily, washing hands before eating, keeping the house and surroundings clean is part of our upbringing. But in this period of transition, we are keeping an eye on others more than ourselves. The question keeps popping in the mind that the person working with us has improved or not. He washed his hands before eating or not. The extent is even that we do not miss to interrupt the front. This creates an untold distance in the relationship. Days of infection do not know who is infected. Therefore, every person in society is surrounded by doubt about each other. This applies to a large extent in the case of strangers. But during the transition, people start keeping a distance from each other. And gradually this distance leads us to racial discrimination. People start to lose trust in each other. So far, such data may not be available, on the basis of which it can be said that COVID-19 is changing our thinking. But it can happen. Our social behavior seen in the days of transition can bring a drastic change in social outlook.